Hey there! So, if you're watching this, chances are you've recently sprained your ankle, and you're in exactly the right place. We're going to walk through everything you need to know to not just get back on your feet, but to come back even stronger than before.
Yeah, that sudden, painful twist, it's one of the most common injuries out there. But what you do next really makes all the difference. You might have some old ideas about what to do, but we're going to cover the modern, science-backed approach to healing. Okay, let's get into it. So, first things first, what is an ankle sprain really? I mean, what just happened in there? Because understanding the injury is totally the key to understanding the treatment and why every single step of your recovery is so important. Okay, so here it is in a nutshell. A sprain is a ligament injury. The simplest way to think about ligaments is like they're super strong, fibrous rubber bands. They connect your bones together and keep your ankle from wobbling all over the place. When you twist your ankle, you've stretched or maybe even torn those crucial little stabilizers. Now, what's really interesting is that about 90% of the time, the injury happens the same way. Your foot rolls inward. This puts a massive amount of stress on the ligaments on the outside of your ankle. And the main culprit, the one that almost always takes the hit, is the anterior talofibular ligament. We just call it the ATFL. It's the weakest of the bunch, so it's the one that usually goes first. And not all sprains are created equal. They're actually graded from 1 to 3, depending on how bad the damage is. A grade 1, that's just a mild stretch. A grade 2 is a partial tear. But a grade 3, that's a complete rupture. And this grading system is so important because it tells your doctor or physio exactly what you need, how much to protect it, and when you can even think about putting weight on it again. All right, probably the very first question that popped into your head was, is it broken? So let's talk about that. Let's look at how clinicians make a really smart, evidence-based decision about whether you actually need to get an x-ray. Believe it or not, rushing to get an x-ray isn't always the right move. To save you from unnecessary radiation, not to mention the cost, doctors use this incredibly accurate screening tool. It's called the Ottawa Ankle Rules, and it's fantastic at figuring out who truly needs an x-ray and who doesn't. So here's the deal. It's actually pretty simple. You only need an x-ray if you have pain in that ankle area and you meet one of these criteria. It's super tender if they press on the very specific bony points of your inner or outer ankle, or if you literally cannot take 4 steps on it. If you don't have those things, a fracture is extremely unlikely. Okay, now for the big one. What should you be doing right now? The first 72 hours are absolutely critical, and what you do here can really set the stage for your entire recovery. Now, I'm sure you've all heard of RIC. Rest, ice, compression, and elevation. Well, things have changed. A lot. We've moved on to POLIC, and the big shift here is swapping out that passive word rest for protection and optimal loading. This is a huge deal because we now know that gentle, early movement is way better for healing than just sitting around doing nothing. So let's break this down. Protection. This is key. We're talking about using an ankle brace, maybe a walking boot, whatever your doctor or physio prescribes to protect those healing ligaments. Then, as soon as they say it's okay, you start with optimal loading. It's just gentle, controlled movement, and it actually tells your body to start healing. And yeah, the ice compression and elevation are still in there to help manage that initial pain and swelling. Okay, so you've survived the first few days. What comes next? Well, this is where we lay out the blueprint for getting you all the way back to 100%. And it all comes down to a structured rehab plan. And look, don't just take my word for it. This quote from the National Institutes of Health says it all. The goal is not to stay still for weeks on end. The evidence is overwhelming. Getting that ankle moving safely and early as part of a proper physiotherapy program leads to way better results than just locking it up in a cast. Your recovery is basically going to follow this 3-phase roadmap. Phase 1 is all about damage control, calming down the pain and swelling and getting some gentle motion back. Phase 2 is when you start to build back the strength. And phase 3, well, that's where the real magic happens. This is where we retrain your ankle's internal support system so this never, ever happens again. Now, to really understand that crucial third phase, we have to talk about this thing called proprioception. It sounds like a big, fancy word, but it's pretty simple. Think of it as your ankle's own little brain. Its subconscious ability to know where it is in space. After a sprain, that sense gets totally scrambled, and that's a huge reason why people end up re-spraining their ankles. So, a massive part of your physio is going to be focused on rebooting that ankle brain. It starts off easy, something as simple as just balancing on one leg. Then, you make it harder by closing your eyes or standing on something wobbly like a foam pad.
These exercises might feel a little weird at first, but trust me, they are absolutely essential for rebuilding that unconscious stability.
Which brings us to our final and maybe most important section. A full recovery isn't just about this one injury healing. It's about making damn sure you never have to deal with this again.
Just look at this number for a second. Up to 40%. That's how many people who sprain their ankle end up with chronic problems. You know, that nagging pain or the feeling that your ankle could just give way at any moment. That is exactly what we are trying to avoid. And here's the tough truth. The number one risk factor for spraining your ankle is having already sprained it before. It's a vicious cycle. But, and this is a really big but, that cycle can absolutely be broken. You are not doomed to repeat this. So how do we break it? Here's your toolkit. Number 1, don't stop doing your exercises just because the pain is gone. You've got to keep up with that balance and strength work. And number 2, your physio will probably recommend using a supportive brace or tape when you go back to sports, maybe for about 6 to 12 months. That gives you some extra support while your own internal stability is still getting stronger. So I'll leave you with this final thought to really chew on. The goal isn't just to be pain-free. The goal is a full recovery. And that means having an ankle that isn't just healed, but is truly stable, strong, and ready for anything you want to throw at it. Completing your full rehab program is how you get there. Thanks for tuning in.